I'm Jennifer Young. I'm a family doctor who's worked in Collingwood, Ontario, a small community, not super rural, but small enough community over the last 20 some odd years, and have had my practice, which includes both hospital work. I worked in Emerge up until November. I still do low risk obstetrics and look after my in hospital patients. I've been part of the leadership here as well over the course of the years, and raised my family, three daughters, and stayed married. Is working in a rural place a recipe for burnout? I might suggest that it's actually not. It provides things that help you to prevent burnout, and I'll just address some of those things. One of the big things that I say to people when they ask for advice about where they should work is live close to where you work. The commute can be soul destroying, and my commute is 5 minutes on my bike, and 12 minutes walking, and has been a huge boon to my quality of life, I think. It also addresses the issue of being on call, and I think there's that, are we on call so much, and what impact does that have on your life? And I would say that being on call, and I would say once every 2 weeks, I am on call for my hospital group, and it's the rare time that I have to go in, and then if I do, it's a pop in, takes 5 minutes to get there, go and see the person, and come back, and it hasn't impacted my social life very much, and I would say my kids have seen that I've been a part of their lives. I've not missed out on the big things, the stuff that really matters.